Today we have fifth surgery MCQs. So we'll go through all of them. So just have somewhere to write the answers. But before the answers come, make sure you attempt this so that you participate. So if you haven't subscribed, subscribe now and hit the bell notification and like this video. Okay, so let's start. So question 1 is saying the most important prognostic factor in carcinoma breast is A. Size of tumor, B. Skin involvement, C. Involvement of muscles, D. Axillary LN involvement, which should be lymph node involvement. So which one is the answer? So what do you think the answer could be on this one? So okay, the answer here is D. Axillary lymph nodes. That's the most important prognostic factor in carcinoma of the breast, because that's the first metastatic place, so to say. But that's the answer for part D. For question 1, that's the answer. We have question 2, which is saying carcinoma breast is commonly seen in which quadrant of breast? A. Upper outer, B. Upper inner, C. Lower inner, D. Lower outer. So for this question, I think this one you're going to get this one correct. So the answer for this question is upper outer, which is option A. Yeah. So question 3, huge orange is due to A. Arterial obstruction, B. Blockage of subdermal lymphatics, C. Invasion of skin with malignant cells, D. Secondary infection. So for this one, the answer here is B. So it's not due to arterial obstruction or secondary infection, and it's certainly not due to invasion of skin with malignant cells, but due to subdermal lymphatics blockage. That's the reason why we have huge orange. Then okay, so another question 4 is also on huge orange. So it is saying the huge orange of breast is due to. So I think this one you're also going to get this one correct, because it's just the same concept as question 3. So we have A. The obstruction of vein, B. Obstruction of lymphatic ducts, C. Obstruction of glandular ducts, and D. Obstruction of arteries. So this is question 4. So make sure you have a piece of paper you are writing the answers, so that by the end of the video you know how many you are going to get correct. So this one, the answer is B. Like we said, this obstruction of lymphatic ducts that causes huge orange. So question 5. So question 5 is saying complications of total thyroidectomy include all except A. Hoarseness, B. Airway obstruction, C. Hemorrhage, D. Hypercalcemia. So for this one, okay, as you are trying to find the answer for this one, okay, I'm sure by now you have written the answer. So for this question, if you see hoarseness, airway obstruction, hemorrhage, so these A, B, C are complications of the total thyroidectomy, and D is not, because one of the complications of total thyroidectomy is hypocalcemia. So it's not you can't have hypercalcemia, it should be hypocalcemia. Yeah, that's the complication. So here, that's the answer. The answer is D. Yeah, so if the answers are coming in fast, feel free to pause the video, so that by the time I'm giving you the answers, you have already answered. Okay, so question 6, vitamin to be corrected in obstructive jaundice. So A. Vitamin K, B. Vitamin C, C. Vitamin D, D. Vitamin B12. So okay, I'm sure by now you must have paused the video somewhere. So here comes the answer. So for this question, so the answer is A, which is vitamin K. That's the answer for question 6. That's the vitamin should be corrected in obstructive jaundice. Then we have question 7. Tumor marker of HCC. A, AFP. B, we have alpha for coincidences. C, DCGP. And D, carbohydrate antigen. So for if you don't know the abbreviations, the meaning of these abbreviations, then I'm going to give you just some of these, because that's the way some MCQs come. They don't even give you the full thing. So if you don't even know the abbreviations, it means you won't get the question correct, because you don't even know what they're asking for. Okay, so here comes the answer for this question. Hope we'll pause the video somewhere. So for HCC should be hepatocellular carcinoma. Then the AFP is alpha fetoprotein, which is a tumor marker of hepatocellular carcinoma. So that's the answer for this question. Okay, so that's question 7. Question 8. Normal length of CBD is A, 7 centimeters, B, 5 centimeters, C, 3 centimeters, D, 2 centimeters. So like I said, for abbreviations, again, if you don't know what they're talking about, so you can't even know. Okay, so you can pause the video. So for CBD, it's the common bile duct. So the common bile duct, what's the length of it? So if you don't know this one, you just don't know. So the answer is A, which is 7 centimeters. That's the answer. Then we move on to the next question. This is question 9. So esophageal carcinoma is adequately assessed by barium swallow, B, barium swallow plus endoscopy, C, endoscopy, D, USG. Should be ultrasonograph. Then of course for this question, okay, so here comes the answer for this one. So for B, which is saying barium swallow plus endoscopy, you can see it's combining both of the procedures, where you apply your barium swallow, then you do your endoscopy. So this is the answer for this question 9. So the answer here is B. That's the adequate assessment for esophageal carcinoma. So barium swallow plus endoscopy. Okay, so we go to question 10, which is saying the ideal replacement for the esophagus after esophagectomy is. So the ideal replacement for esophagus after esophagectomy is A, stomach, B, jejunum, C, colon, D, synthetic stent. So what's the ideal replacement for the esophagus? So it can't be the colon, it can't be the synthetic stent and the jejunum. So here the answer is A, which is the stomach. That's the ideal replacement for a patient who has undergone esophagectomy. So that's the answer for this one. So question 11. So question 11 is saying commonest cause of death in peptic ulcer patients is. So we have perforation, we have hemorrhage, we have pyloric stenosis, we have D, which is malignance. So what's the most common cause of death in peptic ulcer disease patient? So the answer for this question is B, which is hemorrhage. So that's the most common cause, because when patient has to bleed out, that will mostly kill the patient. Because and for A, perforation, this is just perforation to cause peritonitis and the like, but bear in mind that there is still going to be hemorrhage when something is perforated. So that's why that's the answer, B. And of course there are also other reasons, but that's B is the answer for this question. Then we have question 12. Culling's ulcer is seen in A, brain patients, B, patients with head injury, then C, Zollinger-Ellison syndrome, then D, analgesic drug abuse. So for this question, which is A, which is Culling's ulcer is seen in. So if you've gone through the complications of burns, you're going to find it's actually one of the one of the complications of burns, which is your Culling ulcer and your majoring ulcer. Yeah, so for this question, I've already said the answer, so the answer is A. Okay, then we have question 13, which is saying pronounced in postoperative areas is most pronounced in A. Colon, B. Stomach, C. Ileum, D. Duodenum. Okay, so the answer here for this question is A. Colon. So that's the most postoperative areas. That's where the most postoperative areas is pronounced. Yeah. So A for question 13. And question 14, best investigation for acute intestinal obstruction is A. Barium studies, B. X-ray, C. Ultrasonograph, and then D. ERC, which is your endoscopic retrograde cholangiopancreatograph. And then okay, hope you pause the video somewhere. So the answer for this question is B. Your X-ray is your best investigation for IO, which is your intestinal obstruction. So we are done for this one. Question 15, which is saying water loss is severe if intestinal obstruction occurs at A. First part of duodenum, B. Third part of duodenum, C. Mid duodenum, mid jejunum, then D. Ileum. So okay, so for this question, the answer is A, which is your first part of duodenum. That's where there is water loss, which is severe in intestinal obstruction. So first part of duodenum, that's the answer. So question 16, the first to appear in a cause of acute intestinal obstruction is A. Constipation, B. colic pain, C. vomiting, D. distension. So which one is the first to appear between these four symptoms? Okay, so the first thing which appears in patients with IO is your colic pain, which is option B. That's the first thing to appear. Then the other symptoms starts to follow, but it's not constipation. I know you most went with constipation, others maybe vomiting, but yeah, the first thing to appear is the colic pain. That's the first thing which appears. Then okay, move on to 17. So primary feature of small intestinal obstruction: A. Fever, B. High peristalsis with colic, and then C. Abdominal distension, D. Empty rectum. Okay, so for this one, if maybe you use the concept on the previous question, then I'm sure you have gone with B, which is your high peristalsis with colic, since we said colic pain is, yeah. So but sometimes even if the way MCQs are, if you sometimes use some concepts, you find that you even have the correct option. So if you use that concept, same concept here, then you have gotten this one correct as well. Yeah, so that's the primary feature of small intestinal obstruction. So there is high peristalsis with colic. That's the answer. So again, here others maybe they have went with empty rectum, but the correct answer for this one is option B. That's the answer. So question 18 is saying best way to diagnose lower small intestinal obstruction. So best way to diagnose lower intestinal obstruction: A. Pain abdomen, or pain in the abdomen if you want, or abdominal distension, which is option B. C. Profuse vomiting. D. Multiple air gas shadows on X-ray. So pause the video somewhere. The best investigations in intestinal obstruction. So when you do your small bowel obstruction or in your small intestinal obstruction, you see multiple air gas shadows without no ulcerations, because the large bowels are the ones which have ulcerations. So that's one of the differences between the X-ray findings. So here the answer is D. Multiple air gas shadows on X-ray. Yeah. Then question 19, we have all are causes of dynamic intestinal obstruction except. So gallstones, SA, B bands, C interception, and D mesenteric vesicular occlusion. Mesenteric vesicular occlusion. So the answer for this question, if you see A, B, C, these are all dynamic intestinal causes. But for D, it's a dynamic cause. So that's the answer since it's saying except. So A, B, and C I don't want to use the word physical, but there is some obstruction which is dynamic. Then for D, it's one of the dynamic causes. Yeah, so that's the answer for this question. Question D. Then question 20. Oh, question 19, part D. That's the answer. Almost. Yeah. Okay. So question 20. A patient of CA rectum presents with obstruction. Treatment: A. Defunctioning colostomy. B. Atman's procedure. C. Anterior resection. D. Abdominal perineal resection. Okay. So since we are now on question 20, I hope we have gotten more than 50%, more than 60% correct, which is a good thing. Then for this question, the answer is A. Defunctioning colostomy. So this is more of a first thing to do, a temporary procedure where we just make the operation. At first, you make the colostomy, defunction it. Yeah, that's the thing to do. Someone with a CA rectum, you do a defunctioning colostomy at first but it's just temporary otherwise. But that's the first thing to do as compared to the other options. So here the answer is A. Defunctioning colostomy. That's the answer. Then question 21, we have sigmoid volvulus rotation occurs A. Clockwise, B. Anti-clockwise, C. Both clockwise and anti-clockwise, D. Axon direction. Okay, so for this one, here the answer is C, which is both clockwise and anti-clockwise. So that's how the sigmoid volvulus occurs. And that's if you maybe just a tip, if maybe there is a question which is asking for your typical thing, which is your coffee bean sign or your omega sign in sigmoid volvulus, at least now you know that okay, it occurs both clockwise and anti-clockwise. That's how it forms. So for question 22, we have maximum water reabsorption in the gastrointestinal tract occurs in A. Stomach, B. Jejunum, C. Ileum, D. Colon. So here comes the answer for this question. So here the answer is jejunum. So that's where maximum water reabsorption occurs in the GI. Then let's go to another question. Is question 23. Complications of short bowel syndrome. We have gallstones, b.Oxalate renal stones, C. Cirrhosis, then D. All of the above. So what are some of the complications of short bowel syndrome? So the answer for this question is all of the above, because all these are complications of short bowel syndrome. So it's a nice topic to maybe just do a read on it. But both gallstones and oxalate renal stones, they are stones. I'm sure if you got this question correct, maybe if you didn't know if cirrhosis was a complication as well, but if you notice, we have two stones. We have the gallstones and the oxalate renal stones. So you might have wondered, say, okay, for these ones they are correct, and then for C, maybe I'm not sure, but you just realize to say there's also all of the above. So I think that's what, if you guessed right, I think, yeah, congrats. Otherwise, you have gotten this one correct. But if you're new, congrats as well. And we have question 24. It is saying most common indication for laparotomy in intestinal TB is we have A. peritonitis, we have B. intestinal obstruction, C. doubtful diagnosis, and D. lower GI bleeding. So what's the most common indication for laparotomy in intestinal TB? So here comes the answer for this question. So we have the answer, which is B, which is intestinal obstruction. That's the most common indication for laparotomy in intestinal TB. So intestinal obstruction for question 24. Then we have question 25, which is saying the commonest site of tuberculosis of the intestines is A. stomach, B. ileum, C. jejunum, D. colon. So what's the commonest site of tuberculosis of the intestines? So the answer is B, which is ileum. So that's the most common site for tuberculosis of the intestines. So B. Then question 26. When rectal washouts are given to Hirschsprung's disease, the following fluid is used. So when rectal washouts are given to Hirschsprung's disease, the following fluid is used. A. 5% dextrose, B. normal saline, C. soap solution, D. tap water. So you definitely can't use 5% dextrose in this case, and also don't use tap water, we don't use soap solution. So the answer is normal saline. So that's the fluid which should be used, so which is used in Hirschsprung's disease rectal washouts. So normal saline or normal saline, yeah. And then we have question 27. She's saying the most common site of carcinoma colon. Most common site of carcinoma colon is cecum, B. transverse colon, C. right colon, and D. left colon. Okay, for these questions, these are one of those questions where you should realize most of these questions. It's like if you don't know the concept, don't know what they are talking about. Most of them we are meetings like they're just talking about things. We have a lot of most common, yeah, and a lot of anatomy and physiology questions. It feels like it's not surgery, but yeah, it is surgery. This is not internal medicine. This is surgery. So the answer here is A, which is your cecum. That's the most common site of carcinoma colon. Yeah, so make sure you do your studies on your epidural carcinoma of the colon, intestinal TB. Yeah. Question 28. Which of the following is not a recognized complication of colostomy? So we have prolapse, we have necrosis, stenosis, constipation. So A. prolapse, B. necrosis, C. stenosis, D. constipation. So among these, which one is not a recognized complication of colostomy? So now I realize, okay, this is surgery now, because it's the most common thing we talk about in the words. Your stomas, your colostomy, ileostomy, and the like. So complications of colostomy. So A, B, and C are both are all complications of colostomy. So the answer is D. It is your constipation. So constipation is not a recognized complication of colostomy. And we have question 29, which is saying A. postoperative complication of ileostomy is A. obstruction, B. prolapse, C. diarrhea, then D. necrosis. So among these, which one is the best answer? So for this one, the best answer is D, which is necrosis. That's the A. postoperative complication of ileostomy. So necrosis. Then question 30. Most common surgical complication of condyloma acuminata: A. infection, your B. recurrence, your C. hemorrhage, and your D. malignant change. And your condyloma acuminata most common caused by your human papilloma virus, which is so here for this question the answer is B, recurrence, because I mean for the HPV part, your human papilloma virus it's usually like to persist, and it can even lead to cancers, especially in females. But like I said, it's persistent. So if we were to do a surgical procedure in condyloma acuminata, it's going to reoccur again. So B, recurrence is the most common surgical complication for this one. Question 31, saying a virus that has increased association with anodes is A, HPV, B, HIV, C, CMV, D, EPV. So I think I already gave you some answers on the previous question. So not on the previous meme, but on the previous question, question 30. So here the answer is HPV, which is human papillomavirus. So answer is A. And then question 32, we have the inguinal canal is not bounded posteriorly by. The inguinal canal is not bounded posteriorly by A, transversalis fascia, B, internal oblique tendon, C, conjoint tendon, then D, lacunar ligament. So which one is not bounded posteriorly? Which one does not bound posteriorly in the inguinal canal? So here the answer is D, which is your lacunar ligament. So it's the one which does not bound posteriorly in the inguinal canal. So the answer is D, the lacunar ligament. Then we have the next question, which is question 33. Hernia with hydrocele is dash hernia. So A, Gibbons, B, Frabers, C, Dobsons, D, Leobels. So you can pause the video now. Okay, so the answer for this question is A, which is your Gibbons hernia. So that's the hernia with hydrocele. So because this question just a name, so if you don't know these people and you never studied on hernias, then it was a tough one otherwise. Then we go to question 34. The sac contains only a portion of the circumference of the intestines. So A, Richter's hernia, B, Litter's hernia, C, Spigelian hernia, and D, your lumbar hernia. So okay, so here comes the answer for this question, which is part A, which is your Richter's hernia. So Richter's hernia is the one which contains which has the sac which contains only a portion of circumference of the intestines. Then Litter's hernia is, though they look the same, but they are not really, they have different contents. For Litter's hernia, it contains the Meckel's diverticulum. That's what it contains. Yeah, that's for Litter's hernia. Then Richter's hernia contains it has a sac which contains only a portion of the circumference of the intestines. And then you have question 35, which is saying, which of the following does not predispose to abdominal hole dehiscence? So we have A, Fort technique, B, malignance, C, raised intra-abdominal pressure. We have C, which was the same raised intra-abdominal pressure. Then D, odd age. So for this one, you can see that if you have a Fort technique, of course, it's going to predispose someone. Then B, malignance as well. Then C also, but old age has nothing to do with abdominal odd dehiscence. So it's this answer for this question. So question D. For question 35, the answer is D. And then question 36, removal of senescent RBCs from secretion by spleen is called A, Culling, B, pitting, C, filtering, D, phagocytosis. So for this one, the answer is Culling, which is your A. So that's the removal of senescent red blood cells from secretion by the spleen. That's what it's called, A. Then question 37, earliest and often the only presentation of TB kidney is so for TB kidney, the most common, the earliest and often the only presentation. So the options we have A, increased frequency, B, pain, C, hematuria, and D, renal calculi. So which one is the earliest and often the only presentation? Okay, so the answer for this question is A, which is your increased frequency. That's the answer. Then question 38, benign prostatic hyperplasia first develops in the, so your benign prostate hyperplasia first develops in the A, periurethral transition zone, B, peripheral zone, C, central zone, D, anterior fibromyosicular stroma. So okay, so the answer here for this question is A, your periurethral transition zone. That's where your BPH first develops. So this is for zones. So make sure you know these for zones. So for zones, the BPH first develops in the periurethral transition zone. Okay, so another question. So question 39. So in BPH, most common lobe involved is A, lateral lobe, B, posterior, C, median, D, anterior. So this is for lobes. This is for lobes for BPH. So the most common involved lobe is the median lobe. So we have option C there. So that's the answer. Then question 40. Most common site of development of carcinoma of prostate here is, so the most common site of development of carcinoma of prostate is A, peripheral zone, B, central zone, C, transitional zone, D, fibromyosicular stroma. So the answer for this question is, hope you are pausing the video and you have written for the 40 MCQs and have gotten more than 60% correct. So the answer for this question is A, peripheral zone. So that's the answer. So if you haven't subscribed, you can subscribe. You like this video and tell your friends in surgery about this video because they may benefit from it, and share this video to other people as well, even though they are not in surgery, but maybe they might be writing end of rotations or end of exams in surgery. But yeah, you can share it. Then we have question 41, which is saying a specific marker for prostatic cancer is, so we have your alkaline phosphatase, B, your prostate specific antigen, C, acid phosphatase, then D, CA125. So here comes the answer for this question. So the specific marker for prostatic cancer is B, which is your prostate specific antigen, which is option B. So PSA, that's the answer, which is option B. Okay, we move to question 42. So it's saying circumcision is included in the management of CA penis at. So circumcision is included in the management of CA penis at A, glans, B, prepuce, C, granuloprecusio, then D, shaft of penis. So here let's do some logic now. So for circumcision to be included in the management of CA penis, so if it's on the glans, we do circumcision. Then you haven't done anything because the glans is one which is affected, and the foreskin, which is the prepuce, it should be the one which should be circumcised. So I've even given the answer for this question, which is B, which is prepuce. So that's the answer. That's how circumcision should be included at the prepuce. Yeah. So that's the foreskin. That's what it's called. Then yeah. So we can move on to the next question, which is question 43. She's saying if suture marks are to be avoided, skin sutures should be removed by. So if suture marks should be avoided, skin sutures should be removed by A, 72 hours, B, 1 week, C, 2 weeks, D, 3 weeks. So if suture marks are to be avoided, skin sutures should be removed by, so A, 72 hours, B, 1 week, C, 2 weeks, D, 3 weeks. So the answer for this question is B, which is 1 week. So remember, 1 week. So that's B. That's the answer if suture marks are to be avoided. Remove them by 1 week, yeah, which is your 7 days. Then question 44. All the following are cause of blood in stools in children except All of the following are cause of blood in stools in children except A. Mcqs diverticula, B. Carcinoma, C. Interception, D. Juvenile polyp. Okay, so for this question, all of these A up to D, they are all causes of blood in stools in children. But since these are MCQs, we're supposed to choose the best answer. So the best answer should be B, which is your carcinoma, because even though it also causes blood in stools, but it's not commonly in children. So that's why we're going to go with it, because how common, because it's not even common for a child to have a carcinoma, but it occurs, and when it occurs, it also causes blood in stool. But for an MCQ such as this one, where we have other best answers, so the answer is B, which is your carcinoma for this question. So B is the answer. Then question 45 saying congenital hydrocele is best treated by. So congenital hydrocele is best treated by A. Evasion of sac, C. B. Excision of sac, C. Lod's procedure, then D. Hemorrhage. So the answer for this question is that's the best treatment for a congenital. So key point here is congenital hydrocele. So that's for congenital hydrocele. Then anastomosis of small bowel is done by A. Suture in one layer by non-absorbable suture, B. Suture in two layers by non-absorbable suture, C. Suture in two layers by absorbable sutures, and D. Suture in layers by absorbable suture. Okay, so here comes the answer for this question, which is question 46. So the answer here is A, which is suture in one layer by non-absorbable suture. Then we have question 47. The function of hepatic Kupffer cells is, so A. Function of sinusoids, B. Vitamin A storage, C. Increased blood perfusion, D. Phagocytosis. So hope you have paused the video. So the answer here is your D. It is your phagocytosis. That's the function of the hepatic Kupffer cells. So that's the answer, D. Then question 48, we have the best skin graft for open wounds is, the best skin graft for open wounds is A. Isograft, B. Homograft, C. Allograft, D. Autograft. So the answer for this question is D, which is autograft. That's the best skin graft for open wounds. So question 49, split skin grafts in young children should be harvested from. Split skin grafts in young children should be harvested from A. buttocks, B. thigh, then D. trunk, D. upper limb. So okay, so the answer for this question is B, which is your thigh. That's the best skin graft that's where the best skin grafts in children are harvested, from the thighs. Yeah, I know you went with buttocks. I don't know what's up with one buttocks, but the answer for this question is B. This is your thigh. If you went with thighs, congrats. Then we have question 50, which is saying, how much fluids are you going to give in 24 hours in a 5-year-old boy whose weight is 20 kg with 10% burns? So I think this needs some calculations. So we have A. 100 mils, B. 200 mils, C. 800 mils, D. 1500, then E. 8000 mils. So you can pause the video and do your calculations. Okay, I start. So 5-year-old boy, 20 kg with 10% burns, and so to give in 24 hours. So yeah, let's use the Parkland's formula, which is, so these are burns with 10%. So Parkland's formula is equal to your total body surface area percentage times the body weight, also times the range, which is 2 to 4 mils. So we are going to go for the upper limit, which is 4. We are going to use 4 for this one. So we are going to say 4 times 10 times 20. 4 times 10 times 10, 4 times 10 times 20. So we have 4 times 10, which is your 40, then 40 times 20, which is 800. So the answer is C, which is your 800 mils. That's the answer for this question. Otherwise, this is the 50th. This is the question. This is the question 50. So we are done for this one. If you haven't subscribed, you can subscribe, hit the bell notification, and like this video, and give us a comment. Give us a comment if you want to receive more of this video. And also, thanks for watching. See you next time.